Can you explain to me how MAT works?
Yes, muscle activation techniques. We believe that tightness is secondary to weakness, so your muscles tighten up as a protective mechanism. So you don't just wake up and your hamstrings decide to play a joke on you. They could be tightening up because your hip flexors or your knee extensors are actually weak. So it's called reciprocal inhibition. You have to have a certain amount of tension on one side of the joint to accommodate for motion on the other. So let's say if my tricep is not as strong or there's some kind of muscle inhibition, it could be from trauma or overuse or from stretching it, I could get a little bit of elbow flexion this way. So what the bicep or these elbow flexors are doing is trying to tighten up to make sure this joint is stable because it doesn't sense as much tension back here. This often happens with knee surgeries, whether it's ACL, MCL, PCL, or meniscus. The knee extensors, which would be your quadriceps, they're not able to take your leg straight to full extension because the hamstrings tighten up, and those tighten up because it senses that instability on the anterior part of your femur, which would be your knee extensors. So what we do, we go off a range of motion assessment. So we look at active range of motion. So we see where your body can actually control your movement. So we don't do passive for that reason, because then we're always stopped by a structural limitation. So we do comparative mobility assessment, and we can see what side the asymmetry is on. Then from that side, from the side with the asymmetry, we know that if there's a limited range, your body's tightening up to not let you go into the range where your body's unstable. So by going through and testing and treating all those specific muscles and putting the tension back into your system and restoring that balance, now your body's going to give you all the range that you need. So you'll see your range of motion open up sometimes drastically without stretching. Not only that, but now you're stable in that new range. So first we do the range of motion assessment. After that, we'll test a muscle, and then we'll do what's called a DFMAT, a digital force manual application technique, where we apply pressure at certain attachment sites. So after that, we'll retest the muscle. So that's the good thing about muscle activation techniques, is we have the ability to go back and check our work and make sure the muscles do come back strong. So then with the retest, we can make sure the muscle will lock in position, and if it doesn't, we can go through a series of isometrics and try to jump start it the other way. So essentially what we're doing is reconnecting it with the central nervous system, because there's a breakdown in that feedback loop. So by turning it back on, then we can restore the balance.